Hi, this is Cody Clark, and this is my 588 NLN Competency presentation. So I'm going to go through the NLN competencies, the double ACN domains and core competencies that are in accordance with these NLN competencies. I'm going to go through the course objectives as outlined in my syllabus for 588. And I'm going to match those to the practicum time that I've had at Kaiser to meet these standards, requirements, and domains and course objectives. Competency number 1 says to facilitate learning. That is NLN competency number 1. It states create an environment in the classroom, laboratory, hospital, and or clinical setting that facilitates student learning and the achievement of desired cognitive, affective, psychomotor outcomes. I paired this with double ACN domains 1, 5, and 3 that state knowledge for nursing practice, quality and safety, and population health. I felt that these domains were in alignment with course objectives 4 and 3 from 588 that state to collaborate with interprofessional teams through leadership, advocacy, and engagement, as well as to improve healthcare services by evaluating physicians' safety and care processes. The experiences that I took that relate to facilitating learning in 588 state, I supported perinatal nurse educator, the Kaiser nurse educator, and transition to practice onboarding. I guided learners through maternal assessment and assisted in facilitating simulation-based training, which included NRP and postpartum hemorrhage response. I reinforced clinical protocols, supported documentation accuracy, and helped new staff build confidence in performing critical assessments. I provided training to assist transition nurses in bedside and assessment skills, maintaining a safe workplace with evidence-based practices. Competency number 2. States to facilitate learner development and socialization. It states to recognize responsibility for helping students develop as nurses and integrate the values and behaviors expected of those who fulfill the role. The domains that I chose through double ACN's core domains are 2, 6, and 10. That state person-centered care, interprofessional partnerships, professional, personal, and leadership development. I felt these aligned with the course objectives 4 and 3, which state to collaborate with interprofessional teams through advocacy, team building, and engagement, and as well to improve healthcare services by critically evaluating transitions and supporting safe clinical practice. Again, the experiences that I had in clinical practicum that met these requirements were to assist new perinatal nurses in transitioning into the professional role, while providing guidance through maternal assessment education, NRP simulation, and postpartum hemorrhage training. I helped normalize early discomfort, reinforced that competence develops with practice, and provided constructive coaching that promoted clinical confidence. I helped learners grow their professional identity, develop clinical judgment, and build confidence in responding to high-risk maternal newborn situations. Competency number 3 states the use of assessment and evaluation strategies. It goes on to say use a variety of strategies to assess and evaluate student learning in classroom, laboratory, and clinical settings, as well as in all domains of learning. I chose domains 1, 5, and 9 to pair this with. That's the knowledge for nursing practice, quality and safety, and professionalism. Course objectives I chose are 2 and 3. Design innovative nursing practice based on research and advanced clinical judgment. Improve healthcare services by evaluating transitions, safeties, and care processes. And the experiences that I had that pair with this are my support of the clinical educator in evaluating learner performance during maternal assessment labs, neonatal resuscitation training, and postpartum hemorrhage simulation. I use structured competency checklists to help assess technique accuracy, documentation, and prioritization. I witnessed real-time coaching and supported corrective feedback, reinforcing safety standards and clinical reasoning development. Assessment strategies focused on readiness for independent practice, safe clinical judgment, and team communication during high-risk situations. Competency 4, participate in curriculum design and evaluation of program outcomes. This goes on to say, formulate program outcomes and design curricula that reflect contemporary healthcare trends and prepare nurses to function effectively in the healthcare environment. WACN's domain and core competencies that I chose are 1, 6, and 10. That's for the knowledge for nursing practice and a professional partnership, professional, personal, and leadership development. I chose course objectives 3 and 4 to improve healthcare services by evaluating transition safety and care processes, elaborate with interprofessional teams through advocacy and leadership. The experiences that I had that align with these are my work with the perinatal educator to align transition to practice education with unit learning goals and competency expectations. This includes reviewing educational materials for maternal assessment, neonatal resuscitation programs, and postpartum hemorrhage simulations to ensure they supported safe clinical performance. I provided feedback on learner readiness, which contributed to decisions about ongoing training needs and progression towards independent practice. My participation supported continuous improvement of the onboarding curriculum and ensured it remained aligned with patient safety and clinical competency standards. Competency number 5, function as a change agent and leader, goes on to state, function as change agent and leader to create an environment for nursing education and nursing practice. Utilize a biblical worldview and nursing theoretical perspectives such as Parse's human becoming paradigm. I chose domains 5, 7, and 10. That's quality, safety, systems-based practice, personal professional leadership development, and course objectives 3 and 4. Improve healthcare services by critically evaluating healthcare delivery after transition, ensuring safety and influencing healthcare processes. Collaborate with interprofessional teams through advocacy and nursing leadership by networking, team building, engaging, and interacting. I assisted the perinatal educator in upholding mandated standards by disseminating transition to practice onboarding, which included NRP and postpartum hemorrhage education to integrate Parse's human becoming. I emphasize collaboration and encouragement to empower new nurses to effectively join their clinical team. We also embraced professional growth through self-awareness and humility while upholding ethical and faith-based values. Competency number 6. Pursue continuous quality improvements in the nurse educator role. Articulate the methods, tools, performance measures, and standards related to quality. Domain 5 states quality and safety. Domain 7, system-based practice. Domain 10, personal, professional, and leadership development. Course objective 3, improve healthcare services by critically evaluating healthcare delivery, effective transitions, ensuring safety, and influence healthcare processes. In this, I developed surveys and quizzes for the presentations that I disseminated, develop a metric system that ties to the learner's ability to grasp the concepts and their appreciation of the concept. Competency 7, engage in scholarship. Acknowledge that scholarship is an integral component of the faculty role and that teaching itself is a scholarly activity. Apply research outcomes within the clinical practice setting, resolve problems, and work as a change agent. Assessing, educating, demonstrating, planning, and evaluating. I chose domains 4, 5, and 9, scholarship for the nursing discipline, quality and safety, and professionalism. To meet these competencies and objectives, I collaborated with the nurse educator to integrate the most current literature supporting NRP and postpartum hemorrhage. I held simulation debriefs, and this was a way to discuss how to improve clinical readiness of the learners. Competency number 8 is the function within the educational environment. demonstrate an understanding of the current educational environment, and recognize how political, institutional, social, and economic forces impact their role. Domain 7, system-based practice. Domain 8, informatics and healthcare technologies. And 10, personal professional leadership development. Course objectives 3 and 4, improve healthcare services by critically evaluating healthcare delivery, effective transitions, ensuring safety, and influencing healthcare processes. 4, collaborate with interprofessional teams through advocacy and nursing leadership by networking, team building, engaging, and interacting. I participated in the perinatal transition to practice onboarding education program. Showed me how organization pools resources to support education and patient safety. I recognize how collaboration and interdisciplinary communication supports ongoing learning and quality care as these learners transition from learners to nurses on the floor. Thank you for covering that with me. Take care.